We are continuing our discussion on the coronavirus or COVID-19 pandemic. And with new case numbers declining throughout the country and here in Orange County, many residents are questioning what we should do next. Orange County government has lifted its state of emergency and wearing face masks is now optional. So, what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our state medical professionals, and joining us is Alvina Chu, Division Director of Infectious Diseases with the Florida Department of Health in Orange County. Alvina, thank you for joining us today.
Thank you for having me again.
So first of all, happy holidays. The holidays are right upon us, and what should we be thinking about doing in order to keep ourselves safe as we're gathering with family and friends?
So really, the pandemic precautions that we had talked about previously, and not specific to COVID, but to pretty much all infectious diseases that are spread person to person, and even respiratory viruses. So be careful about gathering in large spaces or large groups together in closed spaces. So we encourage good hand washing at all times, after coughing or sneezing, before preparing food, after going to the bathroom. So all those things that you would normally do to protect yourself during a flu and cold season and when you're sick are things that we would encourage you to continue to do through these holidays and through all of your gatherings.
And Alvina, it seems like we're starting to see three different Floridas emerge, with South Florida having different experiences than we're having here, and in Central Florida and even North Florida is having different experiences with the number of cases. Are we starting to see a decline here in Central Florida?
Absolutely. So we currently are what CDC categorizes as moderate transmission. So in the yellow category, I believe the last time we spoke, we were probably in the orange category or substantial transmission. So we are in that category where our percent positivity is low, and also our incidence of new cases is low. In the less than 50 per 100,000 population. And so the transmission has definitely decreased within our community.
And when it comes to the booster shots that a lot of people are hearing about, why are boosters important, and the new approvals that they have and have gotten from the CDC, are they for the general population, or are they for just specific populations within the overall?
So currently the recommendations are for specific populations who are immune compromised and those who are at higher risk for COVID-19 complications. Any moment now, actually, I think today, there may be a decision coming down about expanding the eligibility for boosters. But as of now, we still only have a recommendation for those who are at higher risk. And so those who, such as those persons who are older and those who are immune compromised, and those who might have some higher or increased level of exposure through their occupation.
So the CDC is given approval for children ages 5 through 11 to get vaccinated for COVID-19. How should parents approach this as far as getting their kids vaccinated and even explaining to their kids why they should tune out some of the noise around this vaccine particularly?
So really the vaccines that will help protect children from severe illness and complications, and also help reduce transmission in our community, is important. So while parents might think that children aren't severely affected, there can be sometimes the potential for long COVID symptoms. Some children can become seriously ill, such as with long-term complications, such as MIS-C. And so it's important to be able to protect our children while the risk may be small or perceived to be small, and also to help reduce transmission in our community. So children can carry asymptomatically or have very mild symptoms, and you might not even know they're sick, but still be contributing to the transmission of the virus in our community.
And are we starting to see some of the noise or disinformation and misinformation surrounding this vaccine starting to impact some of the other childhood vaccines that we've been using for decades to keep children safe?
So I can't make a direct link or correlate that myself, but we have seen a concurrent decrease in childhood vaccinations during this last pandemic year. Let's say. So children have been, fewer children have gotten their routine childhood immunizations. And unclear, but it does occur, it has occurred during this pandemic period.
And is the health department experiencing any pushback from the public related to children getting the COVID vaccine?
Well, we do get a lot of questions. So I don't know about pushback per se, but we do have a lot of questions with parents who are concerned about the safety of the vaccine and the effectiveness. And so the best that we can do, as best as we can do, is we try to give them good information from good resources, and then also encourage parents to speak with their pediatrician or their child's healthcare provider to ensure that they're making the best decision about getting their child the vaccine.
And of course, as we mentioned at the top, the holidays are upon us, and what should we be doing to make sure that we are being as safe as possible as we gather with friends and family, some of whom may be unvaccinated? How do we deal with that?
So really, as many layers of precautions that we can put into place that would help us reduce the amount of risk. So really, it's what is the level of risk that you would like to live with. And so getting vaccine, we encourage people to get vaccines to prevent, help reduce transmission and prevent severe illness and death. And we would encourage you to ask your guests to become vaccinated to help. But you can also practice additional pandemic precautions as a layer on top of that, which is potentially wearing a mask to help reduce respiratory virus transmission, especially around those persons who might be older or who are at higher risk for severe illness. And then also, gathering or limiting the group size or the numbers of people that you gather with, and especially indoors, having some good ventilation. So an outdoor gathering better than an indoor one as far as reducing the spread or respiratory viruses.
All right, Alvina, thank you so much.
And then, of course, always...
Go ahead, I'm sorry.
Then, of course, always good hand washing, and remember to practice good hand hygiene.
Well, Alvina, thank you very much for being with us today and keeping us informed from the front lines of this pandemic. We appreciate your time.
Thank you so much.
And we'll be right back with more. Stay with us. The CDC recently approved children ages 5 through 11 for vaccination against COVID-19. Dr. Cynthia Roque, pediatrician with Nemours Children's Health, is here to explain more. Dr. Roque, thank you for being with us today.
Thank you so much for having me. This is exciting.
So one of the things that people are asking is about the landscape of COVID-19 and this pandemic. If cases are starting to decline, then why should we still get vaccinated?
So in pediatrics, what we focus on is disease prevention. And we know that flu season is upon us. We are seeing increasing cases of flu. So although COVID cases are declining, it is still really, really important to protect against infection and disease, because there's no clear way of us predicting what's going to happen when COVID-19 and flu collide. And so we want to make sure that our children are prepared and protected. Prevention is protection. And so that's what our goal is with pediatrics.
And even with us as adults staying home and trying to be as safe as possible, children really can be a transmission vessel that we need to really make sure that they are protected, as well as they are able to not be able to spread the disease as well, right?
Absolutely. There are two really important reasons to vaccinate. One is to protect each child themselves from catching the disease. and number two, to they come home to adults in their lives, and so we want to make sure that they don't spread these viruses and bacteria to the people in their homes, to their grandparents, to their neighbor who may have cancer, to their teachers who may have diabetes. And so it's crucial for them to be protected so that we can decrease the risk of spread.
Now, is the dosing going to be the same for the children ages 5 through 11 as it is for adults for the vaccine?
So, no, what we know now is that the dosing between ages 5 to 11 is about a third of the dose for those children 12 and up, and adult dosing. And that's what's been studied recently.
So what is your advice to parents and caregivers who might be a little nervous about their children getting the vaccine? What would you tell them?
So we typically love to understand that parents want to protect their children. They want their children to be safe. And we know that these vaccines are safe based on the research and the studies that we've seen. And so just we've have years and years and years of study showing that vaccines themselves prevent disease, and all we want to do is keep our children healthy. Vaccines are the foundation to keeping children healthy, so it's important for us to use the knowledge that we have right now and protect our kids based on the facts that we have.
Most adults, when they got the vaccine, had a little bit of soreness on the arm that they were injected in, and maybe, a momentary slight bit of fatigue afterward. Are the side effects going to be the same for children as they have been for adults, or might they be worse because they're smaller individuals?
The side effects tend to vary between individuals. So, what we do know is that the effects usually come from your immune response that's mounted from the vaccine. So, we expect them to be the same. And, some children do much better with them than we can predict. But again, it varies from person to person. But usually it is just that immune response and the pain at the site. So that's what we're seeing now.
And Dr. Roque, how should parents talk to their kids about the vaccine? There's so much stuff on social media and on the news, and so they're getting these sometimes mixed messages. So what should parents say to their kids about this vaccine to really calm their nerves about getting it?
I think it's really important for parents just to be honest with their children. They know that their parents want to protect them, keep them safe. And we know that the vaccines do that. And we're just transferring them, keeping them safe from any other um, risks that they can encounter, like don't run across the street, you're going to get hit by a car. And just having that sincerity with your child and saying, listen, there are a lot of people saying things, but mommy and daddy really just want to keep you safe, and we know that this will do that. And so we want you to feel comfortable with our decision. Children tend to respect that and they appreciate the honesty. And so I think that just by showing them that one way that we care about you is keeping you safe, and the vaccines do that. They keep you safe, they keep you healthy, and that's one way that we show you that we love you.
Excellent. And also, this is the time, as you mentioned early on, where we're starting to get into flu season as well. Can a child get both the COVID vaccine and the flu vaccine at the same time?
Yes, yes, absolutely. Unfortunately, we're seeing that there is about a 30 to 50% decline in flu vaccination rates. And so, what we want to stress to families and parents is that this is the time to protect their kids. We want to make sure that coming into flu season that and holiday season, they are protected, and we know that it's safe to combine the two. So, the sooner we vaccinate, the better chance we have at staying healthy this holiday season.
Absolutely. Thank you so much for being with us today, Dr. Roque, and we appreciate the time that you spend informing us about this pandemic and our best ways to make it through. We appreciate your time.
Thank you so much. This is great, and we enjoy sharing this knowledge and helping you as well.
Cheers. And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve our community. And of course, we are also here to help you keep making those healthy connections. Stay safe.